Hi, good morning. My name is Noemi Perez, and I'm doing a video validation on how to change wet to dry dressing and how to set up a sterile field. The first thing I want to do is check the doctor's order, and then I want to go ahead and introduce myself to the patient, verify that this is my patient, ask for 2 forms of ID, name and date of birth. I want to also verify those IDs with the patient's bracelet. And then I want to explain the procedure to the patient. Then go ahead, wash my hands and put on some clean gloves. I want to provide privacy for my patient, and I want to gather all my equipment, which I already have. I then want to also ask the patient if he or she is in any type of pain. If my patient is on pain, I would administer medication 30 minutes to an hour prior to starting the procedure. And once I've done that, I want to put my bed at a working position so that I could expose my wound, my patient's wound. Once I have my patient at a working level, I want to put that handrail down, and then I would expose the wound. When I'm removing the tape, I want to be careful that I don't hurt the patient. The gauze, and then I assess my wound. I would look for a color, drainage, foul odor, any inflammation on the wound. And I would also measure the wound. I would measure the height and the width, and I would also take a Q-tip and just dip it in and see how deep the wound is. And once I'm done with that, I would just ask my patient not to touch the area of the wound while I set up my sterile field. At this point, I could remove my gloves, and then I could start setting up my sterile field. I would start with my drape. I would just get a table, a clean table, and I make sure it's dry and flat and also above my waist area. I would then open the drape away from me, and I would just pick it up, and I would remove this, throw it away, and just open the drape. This. Alright, and then I would start opening my bowl away from my sterile field. I would just open it away from me. And I would just let it drop onto my sterile field. Okay. And then I would pour some sterile water onto my bowl. I would verify that this is a new bowl. I mean a new sterile water. If it's not a new sterile water, I would just drip some of the liquid to dispose some of the liquid, and then I would start pouring it on the bowl. If it's a brand new sterile water, I would just put the date, time, and initial it, and then I would start pouring. So again, I would just go to the side and pour. I would start pouring 1 to 2 inches above the bowl, just so that water won't drip onto the sterile field. Alright, then I would get my gauze. Again, I would open it away from me, and I would just start throwing it there. And then at this point, I would get my ABD pad, and again, I would just open it away from me and put it there. I always make sure that everything I have on the sterile field is on the center, within a 1-inch border. Alright, once I have that set up, I would start putting up my sterile gloves. Here. I will start with my dominant hand, which is my right hand. Once I have my sterile gloves, I could start just cleaning the wound. This hand is going to stay sterile, and this is going to be my clean hand, so I could clean the wound. Okay, I would start with this. Then I would just pat my wound from top to bottom. Just throw that there, and then I would wash one side from the wound, top to bottom. Okay. And then I would wash the other side of the wound. At this point, I would start packing the wound. I always make sure that this glove doesn't touch the other gloves. Once my wound is, once I have packed my wound, I just take on some dry gauze and I put it on top of the wound. That. And then I take my pad and I just open it and I put it on top of my wound. Okay. At this point, once my wound is covered, I remove my sterile gloves and I dispose of them and I clean my area. I then take tape and just window frame my wound. And then I take, once the wound is window framed, I take a pen and I write the date, time, and I initial it, and I put the tape on top of my dressing. I then cover my patient up. I put the handrail up. I put my patient all the way down at a comfortable position. I also provide the call bell for my patient, and then I go ahead and I record all my findings and all my notes. And that's it. I also go ahead and wash my hands.